Ladies and gentlemen, we are really pleased to have with us this evening for the Fireside Chat, America's top doctor, Dr. Anthony Fauci. Dr. Fauci, as you know, has been director of the National Institute of Allergy and Infectious Diseases since 1984. He has overseen an extensive portfolio of basic and applied research to prevent, diagnose, and treat established infectious diseases such as HIV/AIDS, respiratory infections, diarrheal diseases, tuberculosis, and malaria, as well as emerging diseases such as Ebola and Zika. We know him so much because of the pandemic that we're in right now, and I think everyone is referring to him as the expert on the pandemic, as America's top doctor. And what we love about him is that he not only spreads his wisdom and information with world leaders, but he also reaches out and speaks to individual groups as well as individuals who look to him for guidance about their health and their well-being and how to deal with this pandemic, just as they have sought his advice and wisdom over the years on many other topics. So Dr. Fauci, to move into this chat, this year's symposium for the Office of Research on Women's Health is entitled Integrating Sex and Gender into Biomedical Research for Better Science and Innovation. And right now, we all know the hottest topic in the scientific community and in the community in general is that of the pandemic. And we all recognize and respect your views as obviously the world's expert on the pandemic, as witnessed by all the thank you, Dr. Fauci signs in my neighborhood, in the yards here, and as I drive around this city and everywhere else. So let's start this chat with asking you if you would comment on your views about sex differences that have been recognized in how this virus affects women, from some of the earliest reports that women were less affected than men to some of the more recent reports that the J&J vaccine seemed to have a great effect, side effects in women of reproductive age. So I'd really love to hear your thoughts and comments about that in this Sex and Gender Conference.
Okay, so you're absolutely correct, Vivian, that the earlier reports that men are more affected than women in this is really, I think, very soft data, if you put it that way, because it really depends a lot on the exposure in society. So I don't think that there's a gender difference in whether or not a woman would get infected or not get infected. One of the things that's fascinating that we've learned a fair amount more with regard to the issue with vaccines is that one of the issues associated with this disease is that in the advanced stage of disease, there are aberrant immunologic and inflammatory responses. And as you know, the predisposition of women to have autoimmune and autoinflammatory diseases such as lupus and rheumatoid arthritis and others, we're starting to investigate very, very clearly is the aberrancy of the immunological response. Is that something that we're seeing more intense in women than men? And it's still a black box, Vivian. We don't really know that very much. The one thing that we do know, which is a bit disturbing, is the issue with vaccinations and whether or not in the AZ vaccine and to some extent the J&J vaccine, that there is a very rare adverse event called cerebral venous sinus thrombosis, CVST, which when you look at it, it is rather substantially more prevalent in women than in men. And the interesting thing is it resembles some of the thrombotic events that women get more likely than men do in life in general, certainly during pregnancy, and certainly in some women who are receiving birth control pills. So it's very interesting that we see this adverse event. It's very unusual. It has autoimmune aspects to it, because what happens is that, similar to the heparin-induced vascular thrombosis, in which you get thrombosis together with thrombocytopenia, it is really an autoimmune phenomenon where the body makes an immune response against platelet factor 4, which is released from activated and aggregated platelets. So you get a paradoxical situation of thromboses, particularly the very severe thrombotic events in the cerebral vascular system, particularly the venous drainage of the brain, at the same time that you get thrombocytopenia. And what really we think happens is that you get aggregation of platelets, which give you the thrombocytopenia, but the thrombosis, because they aggregate in vessels such as the venous drainage of the brain. And that's really one of the main issues, really, that separates men from women. We do have I would say, an unusual, which is not unusual when you're dealing with autoimmune diseases. I mean, lupus is extraordinarily more prevalent in women, but men get lupus also. We know that for sure. And I think that's the thing we're starting to see with this rare adverse event in vaccines that have an adenovirus vector in them, namely the chimp adeno with the AZ and the At26 with the J&J. It's still a bit of a mystery. We still don't know exactly why this occurs. We know what the end effector mechanism is, but we don't know what induces the end effector mechanism. The end effector mechanisms is an autoantibody against platelet factor 4, but we don't know really why it gets induced and why we see it with a vaccine that uses an adenovirus vector, but we don't really see it at all in a messenger RNA vaccine, either the Pfizer or the Moderna.
Thank you, and thanks for giving such a clear explanation of something that is discussed without a lot of understanding. So that was very, very good. And I guess it really points out how the years of research really need to be continued, and the community of women's health researchers need to continue to focus on why there are differences in susceptibility to autoimmune diseases. I know there was a lot being done on that when I was at NIH and continues to be. So that was wonderful. But I want to raise one other symptom, because I've had women who've called me being concerned that they have not heard this side effect of the vaccine discussed. So I want to make sure that we do include that in our discussion, and that is the issue related to mammography in relationship to having had the vaccine and possible changes on mammograms. I'm sure you're familiar with that.
Yes, we're seeing this both in men and women, but it's relevant to women because women get mammography, is that usually after the second dose of an mRNA vaccine, I know when I got vaccinated with the Moderna, within about 8 hours after and up to 24 to 36 hours after, I felt a general fatigue, some muscle aches, and some temperature dysregulation. What I did not get was a palpable lymph node in my axilla. However, we've seen several cases, some of our own staff, who've gotten vaccinated and have had rather substantial lymphadenopathy. In fact, lymphadenopathy of substantial size, sometimes the size of a golf ball or even bigger, in the axilla, right at the point where you get the intramuscular injection. Because of that, we've noticed that mammograms that women get are falsely positive. And so the societies of mammography have made a recommendation that women do not get the vaccination either a few weeks before or 4 to 6 weeks after. So if you're going to get an mRNA or any vaccine, you make sure you don't get it 2 weeks before. And if you do get the vaccine, you wait 4 to 6 weeks after before you get a mammogram, because your mammogram might be falsely positive.
Thank you for covering that. I didn't want our discussion to be criticized for not getting on that topic, since some women who've experienced those readings with their mammograms were concerned that they hadn't heard more about it. I see all the many interviews you do, Dr. Fauci, and sometimes I cringe at the questions you are asked. So rather than my giving you some cringe-worthy questions, let me just ask you to give us your comments about what the status of this pandemic is now. We see that, I think the latest news is that the cases are seemingly going down, or new cases are going down in the U.S., but that's not true globally. So let me just ask you to give us what you would like for all of us in the audience to know about your views of where we are with the pandemic right now.
Okay, Vivian, but it's a complicated issue. I'll try and simplify it. It's a global pandemic, and because of so many diverse countries on the planet, the level of activity, the dynamics of the outbreak are very different in different countries. One thing is clear, that it truly has been, over the last now 16 months since we first got involved, it has been a pandemic that has touched virtually every country on the globe. Unfortunately for the United States, we have been hit as bad or worse than any country in the world, for sure. The three top countries of disease burden have been the United States, India, and Brazil. Our numbers are really very, very disconcerting. There have been over 575,000 deaths in this country and over 30 million infections. Right now, we have finished and ended a couple of months ago our third major surge of cases. During the last surge, we averaged up to 300,000 new infections a day and from 3,000 to 4,000 deaths per day. Thankfully, those numbers are really substantially lower now. So we're averaging still a disconcertingly high number of infections, but they are coming down. For example, a month ago, we were averaging 60,000 infections a day on a 7-day average. Right now, it's between 40 and 50,000, closer to 50. Still too high, but nonetheless coming down. Hospitalizations are coming down substantially. And one of the really important things about what's going on in this country is that we have now been highly successful in rolling out the implementation of vaccines. So let me give you some numbers. About 108 or 110 million people are fully vaccinated. That's about a third of the country. About 50% of the adult population or more has received at least one dose. Interestingly, people older than 65 have received, about 80% of them have received at least one dose, and over 65 to 70% are fully vaccinated. This has resulted in a complete turnaround of the high degree of hospitalizations and mortality among the elderly. You might remember the elderly, particularly those in nursing homes, accounted for the overwhelming majority of deaths in this country. Those hospitalizations and deaths have come down to about 75 to 85% less than they were. Now, all I'm telling you is good news about vaccination, good news about the turnaround, but we're not out of the woods yet, and it would really be very dangerous to declare victory prematurely. as the president has said, the goal is to get 70% of adults in the country having been vaccinated with at least one dose of a 2-dose regimen by the 4th of July. By that time, we would predict with a degree of confidence that the number of infections in the country would be dramatically diminished. Meanwhile, as this is happening here, India is in a very deep crisis. They are doing somewhat similar to what was happening in our own country in the late fall and early winter. They're now having about 400,000 cases a day and about 4,000 deaths per day. They have 2 variants in India, a B117, which is the dominant variant here, as well as a variant called 617, which we're just starting to explore now to see whether or not it's well protected by the vaccine. Having said that, it's an extraordinarily unfortunate and paradoxical situation where India is the biggest producer of vaccines of any country in the world, and they're having trouble getting their people vaccinated. They vaccinated only about 3% completely, fully vaccinated of their population, and only a little bit over 10% of people have received 1 dose. So they have a long way to go to get their people vaccinated. So as we hopefully are continuing to come down, countries like India, countries in South America like Brazil, and other South American countries are currently having a very difficult time.
It's been discouraging dealing with so many who are, shall we say, vaccine hesitant, and how to convince those who are concerned about taking the vaccine of the value of acquiring the vaccine. I won't ask you to give a whole spiel because I know it's a complicated issue also, but could you maybe make some comments related to how we can best deal with vaccine hesitancy? I'd like to see us move to vaccine urgency rather than hesitancy, but.
Well, I agree with you on that. And you know, there are multiple reasons why people are hesitant to get vaccinated, and we really don't want to make it a unidimensional thing because there are really different reasons. I mean, some people are hesitant because they want to wait and see, like what's going on with these new vaccines, what's happened to the people that have been vaccinated. And I think the data are very much in our favor in that, because we've now, you know, have given, you know, a third of the country fully vaccinated, a half of the adults partially vaccinated, and we've had no really serious issues except for the very, very, very rare event of the thrombosis and thrombocytopenia that I mentioned to you, predominantly among women. So if they're hesitant because they want to wait and see, I think we waited long enough. We know that they work. We know that they're highly effective. The other one is, I think people need to hear messages from what we call trusted messengers, not necessarily government officials like myself, but people in the community who they trust. That could be sports figures, that could be entertainment figures. Importantly, that could be clergy members, or just someone like a trusted family physician, to explain to them why it's so important to get vaccinated, not only for their own protection, that of their family, but also the societal responsibility to protect the community. So what President Biden has done is to try and make it as easy as possible for people to get vaccinated by establishing community vaccine centers, by stocking tens of thousands of pharmacies where you can walk in without an appointment and just get vaccinated. You know, no hassle, no getting on the computer, not having somebody trying to figure out how you can log in. Just walk into any of a number of 40,000 or more pharmacies and get vaccinated. If you live in a remote area and you don't have transportation, mobile units are going out to get people vaccinated who have not been vaccinated. So we're trying to make it as easy as we possibly can to get people vaccinated.
I want to move to sort of a slightly different view of questioning. You may not be aware, but the first time I heard you speak was when you gave medical grand rounds at New England Medical Center, when Dr. Shelley Wolf invited you there to give grand rounds. And obviously your topic was polyarteritis, or what we call Wegener's then. And I happened to have been the pathologist who handled the cases, the biopsies, on most of the patients with autoimmune diseases, since I was the immunopathologist. So I was in the audience sitting on pins and needles, hoping that what you presented was not going to contradict the kinds of standards that I had been using, criteria I had been using to make my diagnosis. So I was relieved. I was okay. But believe me, that's when I began to really follow more the expertise of Dr. Fauci from the NIH, because it had an effect on me as a person. But that brings up two questions I want to ask. One, you have referred to Dr. Sheldon Wolf as your mentor and made some wonderful comments about having him as a mentor. So I'd really like for you to make a few comments about the importance of mentoring for our men and women in the audience. And secondly, you have been in the forefront of dealing with so many, not only emerging diseases worldwide, but dealing with things like HIV and this pandemic. And I'd really like to know what you've considered the most challenging scientific area that you've had to confront, and what would be a major lesson for the women and men who are listening to this fireside chat today.
Okay, first regarding mentorship. Mentorship is absolutely critical for a young developing scientist. I'm sure it's critical for people in virtually every field, but in science and in medicine, it really is important. My mentor was a person named Sheldon M. Wolf, who at the time that I finished my residency in internal medicine at the New York Hospital Cornell Medical Center, recruited me down to the NIH to take a 3-year fellowship in a combination of immunology and infectious diseases. And when I came down here, his ability to be unselfish in his availability for advice, for counseling, and for partnership with all of us, including me, I got very interested in diseases that he had been already studying. So he took me under his wing, and with a great deal of generosity, he gave me a project and really taught me the fundamental basics of how you think about a clinical problem, how you develop a clinical trial, how you analyze data, the rigor that you need to do, how you don't overinterpret your data, how you don't just disregard things that you might think are insignificant when they might be clues that are leading to something even more important. And we became very close, and he really not only pointed me in the right direction for things, but was very unselfish in allowing me to have the resources that I needed to develop as a very young person in science and in medicine, that nobody knew who I was, nobody cared who I was, but he did. And that was extremely important in that formative years. So I think that people who are very young should seek out a mentor that can be someone that they could go to for advice, for support, for direction. And when you get to be a person at a senior level, make sure that you have as an important part of your own activities that you mentor younger people, because it's very important in the development of their career that you make that particular contribution to them. Now, your second question, Vivian, I'm sorry, which was?
Well, you've dealt with so many challenging scientific areas. What do you consider to be probably the one of the most challenging areas that you've confronted in the scientific arena?
Well, it's in the same disease. One of the most challenging that we've had an enormous success in, and another challenge with HIV that we have not yet been successful. So early on in the course of HIV, we were desperately struggling to develop drugs to treat this otherwise fatal disease, because I and my colleagues spent many years from 1981 well into the 1990s dealing with a disease that sooner or later killed all of our patients. In the early years, it was very rapid because you didn't get to see anybody until they were advanced in their disease. And the median survival was about a year. As we started to get some early drugs, single and double combination, we were able to get people to extend their lives, but it was still a potentially fatal disease. Then when we developed the multiple combinations of drugs, 3 or 4 drugs together, we completely turned around the course of HIV, having it go from a death sentence to people now living normal lives, essentially with a normal lifespan, almost, maybe off by a year or 2. And also keeping the viral load below detectable level consistently to the point where they never transmit the virus to anybody else. It's called treatment as prevention. The challenge that we have not been as successful thus far, but we're still trying very hard, is the development of a safe and effective HIV vaccine. And the reason for that is the body, for reasons that are very complicated, does not like to make an effective immune response against the virus. So we've got to do better than natural infection. And we've got to induce in the body a response that it doesn't make very readily against natural infection, but that we wanted to make against the vaccine. So that remains the enduring challenge that we have for future years.
I know you recently published a paper with Bob Eisinger on the complications of HIV during the pandemic or in conjunction with the pandemic. You want to make a comment about your findings in that regard?
Yeah. People who are on therapy with a normal CD4 count and an undetectable viral load really are no different than anybody else with regard to their response to being infected with COVID. But it's mostly the comorbidities that people who are living with HIV have, the increased incidence of heart disease, diabetes, obesity, and things like that, that put them at a higher risk of a severe outcome. And of course, people who are untreated, who are HIV, living with HIV, as many people in the developing world who have an abnormal and very low CD4 count and who have a high viral load, they are considered, as you might expect, to be immune deficient, which means they have a much greater chance of a severe outcome to COVID-19.
We're running out of time, but I have a couple of more questions I want to ask you. Can you stay with us for a few more minutes for a couple of more quick questions?
Yeah, a couple of quick ones because I got to run, but go ahead.
All right. This one I think you'll like. We all listen to your interviews and we hear you often fondly refer to your wife and your daughter. So we know you have a respect for gender equity and fairness, as well as a respect for them and all of us as women. So what advice would you offer to women in general, and especially to women pursuing biomedical careers, in dealing with the challenges and barriers to gender equity and opportunities in today's environment?
Well, you know, I think today's environment is much different than it was when I first got into medicine right now. And I think you could see that. I went on rounds the other day, and, you know, usually, you know, rounds, there are 14, 15 people on rounds. Back when I was making rounds on the ward at NIH in my first year of fellowship, it may be 14, 15 people on rounds. You know, there was 12 or 11 doctors who were all male and 4 nurses who were all female. Now we have 15 people on rounds. You have 12 doctors, 10 of which are women and 2 of which are men. And we have some male nurses and female nurses. So, women have arrived in medicine. I mean, they've already proven in every respect, from being basic researchers to clinical researchers to clinicians. They are not only equal to, in every respect, equal to or better than anybody else. So I know there's still degrees of inequity with regard to promotion and positions, but with regard to already proving yourself that you can do it as well or better than anybody else, I think that's already done. I don't think that there needs to be any further proof of that. It's just a question of making sure that in those areas, wherever they are, in a hospital or in an academic medical center, that we pay close attention to equity, because it's equity based on real talent and accomplishment, not necessarily equity on upward mobility. It's not upward mobility anymore. It's really somebody who really has the capability of being in a high position.
And I can appreciate that, having been the only woman in my medical school class. It was me and the nurses, and that really has changed. I'm gonna word this very carefully. You have a unique and admirable way of responding to non-scientific based ignorance of scientific truths and the misinformation that has had negative consequences for so many during this pandemic. And we admire how you have been able to handle this. What advice could you offer our audience about how to respond and maintain a calm sense of self-integrity when confronted with such emotional challenges in the scientific and political arenas?
Well, Vivian, the thing I've stuck by is always stick with the science and the facts, and don't get put aback when people say or do outlandish things, because you don't respond to them in an emotional way. You don't get angry. You don't get resentful. You just respond by evidence and data. And when people, act in a way that is completely contrary to the truth and to science, you don't want to, get into their world of arguing back and forth in a way that is pejorative or angry or emotional. Just stay, nothing personal, strictly business and scientific. You do that and you stay out of trouble.
My last question, as well, who I'm sure is the most recognized name in the world, and certainly the most respected and adored name in the scientific world as a scientist, researcher, and physician, what words of advice and inspiration would you offer to our young and not so young men and women who are listening to this fireside chat this evening about the worthiness of such a career and why it's important for them to continue to pursue careers in biomedical sciences?
Well, I have experienced, and virtually all of the people that I know in my own peer group and younger, if you have a bent for medicine and science and biomedicine, there's absolutely nothing that can be more, in my mind, more gratifying and fulfilling than a career in a discipline whose ultimate goal is to alleviate suffering and to save lives of people. I mean, I think when you just think of that and what you do, not to put down any other profession or any other specialty or any other career choice that people have, I can't think of anything more rewarding than that. As tough as it can be, as hard as you work, as the hours that you put in, depending upon the path within the biomedical arena that you take, it is extremely gratifying. So look forward to something that you're going to really enjoy very much, that's for sure.
I want to close this by thanking you, but most of all to let those in the audience know I was there at the start of the Office of Research on Women's Health, and I can honestly say that Dr. Fauci is not a Johnny-come-lately. He was very supportive of our earliest efforts and has continued to be so, and obviously has continued even in the years since I have left. So I want to thank him not only for giving us this time today for the Fireside Chat, but for all of his efforts in support of not just women's health research, but in supporting efforts to increase scientific knowledge as well as careers for those involved in biomedical careers. And Dr. Fauci, we adore you. I've got one of those signs in my yard too, so thank you.
Thank you, Vivian. It's great being with you. I appreciate the opportunity.
Thanks. Okay, I'm back.
Hi. So thanks to everyone who joined. I just want to do a quick thank you to Dr. Fauci for his time that he took. And obviously I want to thank Dr. Pinn for joining him for the Fireside Chat and asking such wonderful questions. I hope that I don't ask any cringe-worthy questions today. And if I do, just tell me on chat. Don't tell me now. But I want to allow us the space to kind of open up and have a conversation. I would do an introduction, but I think everyone knows who you are at this point. We're here all for you and your legacy. And again, I just want to say I'm grateful for the opportunity, one, to have been able to chair the Vivian Pinn Symposium and work with so many other people who look up to you as much as I do. But in addition to that, I really want to thank you for your commitment for being on the committee and also giving your advice and your expertise on women's health. So I just want to say thank you for that. And again, thank you for being one of my mentors, and obviously a lot of the mentors for a lot of other people who joined the meeting today.
Thanks,
I wanted to start off, of course. So I wanted to start off quickly going back on what you were discussing with Dr. Fauci. I wanted to start questions, and I want to also just allude to everyone. Please know that you can use the Q&A function. You can ask any questions, and I'll facilitate those and ask those to Dr. Pinn, but I'm going to start with a few questions until we get a few in the chat. So my first question is going to be on mentorship. And I want to understand and ask you asked this question to Dr. Fauci, who was your mentor, but I want to spin it a little bit and ask you, who has been your mentor throughout the life cycle of your career, being that you've made it to leadership, and understanding has that changed? And more importantly, in what ways and what things should you look for in a mentor to get to maybe the point that you're in, but more importantly, to be successful?
Well, let me see how I can answer that. First of all, I thought it was very important to have someone like Dr. Fauci talk about the value of mentorship. I'm really struck when I hear people who've been successful say they got there on their own and they didn't have mentors. I don't believe that for a moment. It's a matter of acknowledging who has supported you and advised you along the way. I think when I was coming along, we didn't really call them mentors. It was who did you go to for advice and who could you ask to help you when you had questions personal or related to careers. And because I've had so many mentors and advisors through my entire career, I really want to tell you a different story, and that is why I think mentoring has been so important to me. When I was in medical school, I was the only woman in my class, the only person of color too, and there were no faculty of color at my medical school in those years, but there was only one woman full professor. And I learned in the very early days of medical school, in the pre-class starting days, that she was not very receptive to reaching out to women, and the women were me and the nurses. And in fact, I really just felt no warmth from her at all, and never felt that I could go to her for questions, which meant that here I am, a female medical student, and no one that I felt I could go to in a senior position who was a woman who could give me the kind of advice that I needed as a woman in a man's world, so to speak. And I think it was that negative experience with not feeling that I had a woman who was willing to be a mentor to me, and I saw her treat me and the nurses differently than she treated the young men who were in my class who adored her, that I think when I finished medical school and became a junior faculty member and then a faculty member, that when students would reach out to talk to me, no matter how busy I was or how far behind I was, I didn't think I could say no to them. And I felt if I could be there as an ear to listen to someone who needed advice or just wanted to talk about issues, that I had no right to say no, because I know how much I felt I needed that and missed that while I was a medical student. And I really think that's what really got me involved in mentoring. And along the way, I had people who, from family members to professors
to very few women in medicine. So most of my early mentors were men, and then women of color, and then women who were in senior positions, and then my students who advised me on things that I learned a lot from just dealing with them. So I really couldn't single out. I could give you a few names, but let's just say over my lifetime, I've had many mentors, and today I have women that I consider mentors, even though some of them are younger than I am, but they've got wisdom. They have knowledge about science or about politics or about just surviving that has really been valuable for me. But I think the central message is that mentoring became so important to me because I felt a lack of it when I needed it the most, and I really never wanted to be seen as that professor whom I'll never forget. That was the fall of 1963, and I still remember that woman, and I would rather be remembered for having been available to help someone, to mentor someone, than for not being available. So that's a different turn on your question, but it's a sincere answer.
I appreciate it. I was actually going to ask you the question based on the fact that Dr. Fauci also mentioned the importance of his mentor being unselfish. So you kind of answered that question, but I also just want to flag for you or ask you the fact that you have been so unselfish. Has that done or has that had any effects or barriers to your career, being that so many women do face that as an issue, oftentimes being there's a burden or extra burden because they are women, oftentimes even a woman of color, and most people will go to them because they have that expectation, but that also creates sometimes a barrier for their success and their advancement. So I wanted to understand from your perspective, do you feel like that ever was a barrier?
I can't say it was a barrier. There have been times when I've been tired and people want to talk to me because they have problems, and I'm thinking, I've got some problems myself I need to deal with. But because knowing the importance of sometimes just for an individual to be able, you don't always as a mentor solve problems. You really are just there to offer advice, or sometimes just to hear an individual talk out what those problems are and reach their, really help themselves to get through an issue. So I would not say it was a barrier or a burden on me, because knowing what I felt I missed, if I could do something with just providing a few more minutes for someone to help them deal with whatever that issue was that was so important for them at that moment, then it was worth it. So I have not regretted at all the time. And as you know, being in Office of Research on Women's Health, mentoring was so important that many of our career development programs that we developed in the office, and many of them still exist, have dealt with or have included mentoring as part of the basis of the design of the program, just because I thought mentoring was so important, and not just informal mentoring, but really dealing with mentoring formally also. And if we could do that through NIH programs, all the better.
Absolutely. And I know that this might sound tart, but I appreciate the fact that you did not have that support, because I feel like so many people have benefited from the fact that you didn't, and having the willingness to be so unselfish. So I want to thank you, and I'm sure on behalf of a lot of people who are in attendance, they want to thank you as well for everything that you've done as far as your dedication. I want to just quickly, I want to pull one of the questions from the chat, and then I'll ask some follow-up questions. But one of the questions is, what advice would you give current PhD students, especially from underrepresented backgrounds, interested in government service, who would seek mentorship? For example, is it okay to send a networking email to someone who did not have a professional relationship with?
Yes, just know that I get so many emails every day. I'm up till 1 and 2 in the morning trying to keep up. So if you don't get it, I heard the other day someone was upset because they'd sent me an email and 2 days later I hadn't responded, and I'm thinking, I don't know, what about those that are waiting a week or a month? But anyway, but I think in terms of seeking positions in government, that gets to be a bit tricky. And so if you're looking for something in government, like now, I have no idea what positions are available and don't have the contacts that I once did, but I would encourage anyone who is interested in that to consider and to seek those positions or to seek contacts. It is important to find out who can give you the ties or give you those connections. Pay attention to what's posted. Learn how to read the postings and the guides, because most new positions are there. But it's also important to talk to people who have been in government service, to know, For example, there are not lots of physicians in women's health, and I hear from many, many women who say, I want to do women's health and I'd like to do it in the government. Well, there are not a lot of physicians, but you can do women's health research in a variety of ways, whether administrative or in a research lab, or dealing with it in terms of the political arena. There's so many ways you can. So I would like to encourage young women and men who are interested in government service to think about it. I have to tell you what, I shouldn't be talking about myself and telling funnies on myself, but when Dr. Healy invited me to come and head up this new office as it was then, I have a reputation for saying what I think, and what I said to her, because I had this idea, in government, which is true. You can't just say anything you think. If you're representing the government, you are representing the government. You have to say what represents what the government stance is. And when she asked me about coming, my first response was, Dr. Healy, I can't come work in government because I like to say what I think, and I'm sure I won't last very long in government. But she convinced me to come and try, and once I did, got a whole different idea and a whole different understanding about how government works and the important role that government can play, which I really like to spread among many of those now who don't understand the importance of government in improving their lives and their health and their well-being. But just having to keep in mind that you may not see the dream job. There are only going to be so many who are going to be the director of the Office of Research on Women's Health or the Office of Women's Health in agencies, but there are many other ways you can contribute. And I think we do need good people who are interested and dedicated within the field of government, but not to eliminate it, to go for it, but also consider other options and maybe variations on the theme. Just as I never thought about leaving the field of pathology to go into women's health, although I've been spending so much time on women's health and minority health just in my free time or not free time with community outreach and speaking to groups and wondering why others didn't do more of that. But it was a whole new area for me. And so I would encourage others to consider many different opportunities, and you may find your niche. I must say, the last 30 years of my life have just been wonderful in dealing with an area that really didn't exist prior to about the late 80s, early 90s. So, but it is important to get a feel and to have an understanding of what you're looking for and what the opportunities are. And that's not a good answer, but that's the best I can do because there's no set answer to that.
I want to go to a few questions, but I want to ask on the beacon what you just were stating, being that you kind of entered this field and it was a new field, do you have any advice for people who are trying to transcend a field or more or less move into a field that one maybe does not exist and or is new?
Yes, be open to opportunities. Always be open to opportunities, things that may for a moment have you concerned about whether or not you can handle it or what you can do with it. I must say it was so exciting to be given the opportunity to help mold what women's health research would be and where we would go, knowing I didn't have all the information, all the knowledge, able to call on people to help us do that and to get that coalition of groups and advocacy groups and scientists and mentors and just interested people. And I must say, when the office first started, we got calls from as many husbands and spouses as we did from women about their health and what the office could do. And that was so exciting. I never intended to be in government for 20 years, which I was before I retired. But before I knew it, 15 years had gone by. And one day I looked up and thought, my gosh, I've been here 15 years. I need to start thinking about moving on so somebody new can come in with new ideas. And so I encourage everyone to consider any new opportunity that might come, even something you're not familiar with, because you can bring your own perspective, a different perspective, and you can grow as well as the new field of the new opportunity. That's what science is about, finding new truth. And that's what we try to do for women's health. And that's what you can do in almost any field related to science or medicine or whatever your area of focus is.
Thank you for that. I think that will encourage a lot of people. I want to move kind of based on something you stated a little bit, but there's a question that says we, of course, focus on support for women in science and medicine, but it is also critical that we educate men, at least those in leadership and those in the pipeline, on these issues as well. How do we do that? And what do you feel like are the best strategies to make this effective?
I remember once I was invited to an institution, I won't call the name, but I had a good friend this was after I left pathology and I was doing women's health research, and I had a good friend who was a male who was the chair of the Department of Pathology at that institution. And he picked me up at the airport, and as he was taking me to the school for my talk, he said, "I'd love to hear you talk, but I was told this was for women only." Well, I thought, we've got to change this, because we can talk to each other, but in the real world, we're dealing with men as well as women, and men need to be with us and for us and working with us. And that means an understanding of the issues that men are facing in their careers and having them understand the issues we're facing related to our careers and our health. If you look at our advisory committee, we always had men on our advisory committee. We had representatives from what I like to say when I focus on intersectionality. If you look at the advisory committees over the years, we truly had intersectionality, including men. And I knew that one of my major challenges when the office first started was to get men in science and medicine to appreciate what this office was about, that it was not an office to be politically correct, and that it really was a true scientific endeavor, and to get men on our side working with us. And that was one of our major challenges. And it just meant getting people to work with us, getting them involved, having them participate in the discussions, and have some ownership of our programs and our ideals as they develop. And that's what makes a difference.
Perfect. Just on that same note, someone's going to just talk about this tomorrow, but do you want to give any notes or talk about male allyship and, again, strategies that might allow for us to work better with men on these specific issues?
I think that's going to be Leon McDougall, who is president of NMA, is going to be speaking on that. I know he's published papers, and I'm really pleased to see that he has focused on some of those issues. I think maybe someone else, but I know that's one he's dwelled on. But it just means having an open mind. You have to realize, suppose it were the other way around and you had men off talking and they didn't want you as a woman to participate. So just think of it in reverse. So why should there may be some personal things, but having been in medicine where you discuss men's intimate issues, women's intimate issues, if you're a physician in medicine, you sort of get used to talking about these things in mixed company. And if you aren't in medicine, but just think in general, you don't want to exclude someone because you have to think about what if the tables are reversed. And we have been excluded from so many things over the course of our early years as women and even to some degree now. Why should we perpetuate that sort of reverse separatism? And I think if you keep that in mind and recognize that there's nothing, I think dealing with sexism, racism, any of these, homophobism, all of these isms, that the best way to really overcome them is to be able to discuss them unemotionally. I love Dr. Fauci's advice. That question to him about how do you deal with those who come at you with these emotional, non-science-based questions, and we've seen him in circumstances where he's dealt with that so calmly. I'm not sure I could be that calm, even with all my years of experience. I thought it was worth having him address that. And I think that that's how we can help, we don't want to say win over, but we can have mutual discussions so that you can hear opposite viewpoints and come to some likeness of mind by understanding different viewpoints, and then coming out of that with a better understanding of what the other individual or what you are trying to put across. So to me, the main thing is to be able to discuss these issues and to understand them. take them personally if they affect you personally, but don't react personally, don't react emotionally, as I tend to do, but be more like Dr. Fauci with a calm endeavor. Remember, that's why I said I wasn't sure I could come in government, because I like to say what I think, but being in government, I learned how to be tactful. I learned how to be diplomatic most of the times, and that was something I need to learn to do. So we need to do that in terms of winning others over. Nothing gives people more of a feeling of being part of a movement or a new issue than having some ownership, which is why it's important to get those, especially those who seem to be opposed, to help develop the concepts so that they have an ownership of the concepts and where you or it is going. That's a long answer, but.
No, perfect, because I completely agree. I want to make sure I get to the last question in the chat, and then I have one last question, and then we'll wrap up. It says, can you share the history of the NIH re-entry supplement and comment on my situation? I have complete hiatus from any paid research activities for 5 years without payment as an OBGYN trained injury and alcohol epidemiologist. I have been passionate on publishing and submitting my proposals to NIH and the CDC.
I'll see if I can do this quickly. When we held our first conference on women in biomedical careers, which was in 1993, we had seen and heard from so many women who had interrupted their careers because they either took time out to have babies or took time out to take care of an elderly relative or an ill child, or to move as spouses, because remember the early 90s. Now we see males moving with female spouses and vice versa. But then in those days, it was mostly women moving with their male spouses and having to give up their positions. And so we thought about it and why should someone who's fully trained, has been through the education, has the experience and the desire to participate in research, lose their careers just because they've had to take time away for family responsibilities, is how we put it. And so, we tend to develop things based on recommendations from conferences and workshops. So we designed in that workshop a special working group to take a look at the need for reentry. And so out of that workshop came a recommendation that our office and NIH should consider programs to allow the reentry of women and men, because every program had to include both men, but women and men, back into biomedical careers. And Joyce Rudick actually led the development of that program, and it started as a pilot program for us with just a few institutes taking that on. Eventually, I think most of the institutes at NIH ended up implementing that program, the concept of reentry. I'm not sure exactly where it is now, but it really was more for research and not so much for medicine, a practice of medicine, but for research. And with that, what we did was design it such that it was sort of like what were then the minority supplements. In other words, if you had spent some time in research and you'd been out of it, you could identify someone who had an NIH grant, and then our supplement would pay for your salary or some support, so that a funded investigator would be willing to take you on, because you wouldn't be taking funds, you'd be an extra hand. But the idea was that you would get the experience of working with a funded investigator to retool on your methods or to get back involved in research, with hopefully the idea that during that time you would then be able to develop your own research proposals and again become an independent investigator. And a side thing is, because I remember there was a conference and I was asked to discuss that, and the first comment I got was from a senior male scientist who said, women can't take time out and come back in, even men can't do that, so why do you think women can re-enter? And as I sat there, remember, I'm in government, so I'm trying to think how to give a diplomatic response. One of the other men at the table said, well, I don't know. My daughter took some time out and she came back into the lab. And then another one said, well, my wife did the same thing. And then someone else said, my daughter-in-law did. And I sat there beaming, because while I was trying to think how to be diplomatic in response, these men had experienced it in their families, in their personal environment, and they spoke up in support of the program. And then when we made the awards, I can remember we had many women who applied, and most of the awards went to women. But one of the first awards we made was to a male who had interrupted his research career so that to take care of his ailing in-laws so his wife could continue her research career. And so once we showed it was applicable to both men and women, we didn't see as much opposition. I'm not sure where that program is today, since actually I retired. Believe it or not, it'll be 10 years in August since I retired. So I'm not sure where that program is. But I'd say if you have an interest, it's difficult if you don't have pilot work or don't have a pilot project. So if you're interested in being funded again, try to seek a funded investigator who'd be willing to let you work with that individual, or at least share the lab or contribute or view, so that you can get brushed up on your techniques and try to participate even as a co-author or contribute to research that's going on to really build your credentials again and get back into the research environment. And that's a brief answer. I could go on and on. That's a brief answer, but don't give up. We don't who's committed to research. There should be a way for you to find a way back.
I'll just comment quickly. The program still is in existence. We did not let it go, and it's actually currently right now we're leveraging it or thinking about leveraging it for the problem, or the pervasive problem that's happening around sexual harassment. So it is still ongoing, and please look at our website. There's the program information on there, and if you need more context, if you need more information, I'm sure you can go to what's the name of it? I apologize. In the exhibit hall, in the Lab Roots platform, there's more information that you can get from us about the office, but also it allows you to connect with either our comms or myself as far as email, and we'll be sure to give you more information. So I just wanted to ping that for everyone.
So Jamie, before you shut me off and say we have to go, because I want to just comment how exciting today was for me. I have been gone now, at least out of the office for, as I said, about 10 years. And to hear the current women and men who spoke today, taking the concepts that we thought about, but many that we never got around to developing, and under Dr. Clayton's leadership, just seeing where the office has gone, the interest, the new investigators, the new scientists, the new administrators, those who are participating in this symposium, is just so exciting and so inspiring for me. So I want to thank you and the office and Dr. Clayton for carrying on this manifesto, if you will, and making us all feel really good that women's health does have a lot more to do in terms of research and career building, but you all are doing it. And I want to commend you as the old person gone, but watching what you do. I'm so pleased and delighted. And thank you for giving me this opportunity to say a few words. I've never been short on words, but thank you for giving me the opportunity.
Well, I thank you, and I will also just make the statement and a shout out to Dr. Clayton, one for her leadership, but also the importance of the fact that she's mentored me as well as you, and I've learned the art of diplomacy by both of you all, so I do understand that key thing for government. I do want to ask one quick question. I know you made a comment around researchers, but there was a comment around government. There are a lot of people on this call that are currently in government, and I wanted to understand from your perspective, what do you feel, being that you can be open and honest about this now, what do you feel needs to happen for more women to get into leadership positions, and also what ways do you feel we can actually be advanced?
Well, I was delighted hearing Dr. Collins speak this morning, and knowing some of the issues that are being addressed at NIH in terms of diversity, not just in terms of racial and ethnic diversity or cultural diversity, but also knowing that diversity and intersectionality applies to women also. And so I think you have to, just as that report that the office supported, that the national academies did on promoting women in academic medicine, I think it applies to government agencies also. You've got to have the data. You've got to know where you are. You've then got to document what changes there are. You'll never know if you're making progress or not making progress if you don't know what the beginning line is and if you're adding to those numbers, and not just adding to those numbers. Another principle that we developed out of our biomedical careers attention was we were talking about promoting women into leadership positions, and we were told and asked, in fact, implored by a number of women in senior leadership positions to not forget those who are in senior leadership positions, because it can be very lonely there, and many of them felt they didn't have the networking or the support once they got into senior leadership positions to be successful. And I think the same is true as you look at, and so for sustained leadership. So I think you have to look at not only are you increasing the numbers of women who are moving into positions or moving into position, being promoted into positions of leadership or tenure at the NIH, if you will, and are there efforts in place to help with networking and support or mentoring, however you want to label it, to make sure that once women have moved into these senior positions, that they have the support they need from both women and men, so that they can have sustained success as they move up the leadership ladder. So yes, I think it's important to have that support. I can remember small groups of networking women, networking in institutions, important just as it is in government. You don't include everybody maybe if they want to, but it's so important to have a few people you can reach out to if you have an issue, to get advice on how to best handle it, to get wisdom from someone else. And sometimes just to blow off steam, so you don't do it on email and you don't do it in a meeting, but you say, can we just get together and have dinner? Let me just tell you what I'm facing. How am I going to deal with this? And let me blow it off. And now I can be calm and go back and deal with this with your advice and how to best deal with this. There's nothing better than having someone you can confide in, especially at the same level or who has been at your level, to help guide you. And I guess that all comes back to mentoring and sponsoring. It's really using that networking. I think it's important in professional organizations. I think it's extremely important in institutions, and it is important in government too. I had several groups like that that advised me. In fact, one group of women scientists at the NIH, before I came, invited me to dinner, and I thought they were just going to welcome to the NIH in this new position. And I got there for dinner, and they set me down, and then they said to me, once you get in this job and have this title, if you forget who you are and where you came from, we're going to let you know. I never forgot that. That was the fall of 1991. I never forgot that. And I hope I never forgot who I am and where I came from.
Well, I actually would love to end it on that note, but I want to wrap up, but I want to give you the chance to give, I know that you usually do pearls. They're called the Pin Pearls of Wisdom. I had an opportunity years ago to actually interview you. That was my first time meeting you. And again, we're back together again for another facilitated discussion around career. I just want to ask you, being that we are still currently in a pandemic, what is your pearls or your the pin of pearls of wisdom that you would love to give or would like to give to the audience, especially now that we're in a pandemic?
Well, I have a couple of pearls of wisdom. One is, and it flows all through this discussion, but one is to have a mentor and be a mentor. The second one is to reach for the stars, reach for the sky, because if you don't, you're going to be stuck in the mud. And that really goes towards looking for opportunities in new fields or new areas that you might not have thought about. If you don't try for it, you'll never know whether or not you could have gotten it. You'll never know whether or not you could have been successful. So why not reach for the best and aim for it? A third one is to have self-confidence, but not arrogance. I really have a problem with folks who are arrogant, who feel they've made it and have no time for anyone else, or you can't tell them anything. I think it's very important, especially for young women today, and especially for women of color, to have a sense of self-confidence that you can do. In other words, overcome, get rid of that imposter syndrome. But at the same time, don't assume that degree of arrogance that so often comes with success. And in terms of the pandemic, Dr. Fauci, it's so frustrating for me when we've learned, especially for communities that are suffering the most from the pandemic, that we get a vaccine that scientists have invested in. Don't listen to me, listen to people like Fauci and all of the others who have years or lifetimes of experience, and people don't want to accept it or believe it. They will go for the false conspiracy charges or comments. And I would like to see vaccine hesitancy become vaccine urgency. I was in CVS the other day picking up my blood pressure prescription when this teenage boy came rushing in, and it was 6 o'clock. The pharmacy was closing, but he came in and he said, "Can I just walk in and get a vaccine?" And I was disappointed because the pharmacist said, "No, we're closed and you have to make an appointment," when we've all been told you can walk in and get it. But I really wanted to pat that young man on the back, but I knew I might get accused of something, so I didn't. But to myself, I patted him on the back because here was a teenage boy who came in anxious to get the vaccine. And that's what I'd like to see more of. And I think some of these teenagers are going to really convince some of their parents of the importance of the vaccine. So in the pandemic, we need to go with that question I asked Fauci. We need to believe in science. Science represents the truth. Don't try to be the expert. Yes, you want to know about it. You don't want to be ignorant about it, but you don't want to assume you know more than everyone else. And to move and shift our populations who really need the protection or who can expose those who are more vulnerable, to move from vaccine hesitancy to vaccine urgency. That's my little term, vaccine urgency. That's what we need.
Well, Dr. Pinn, thank you so much for your time and your pearls of wisdom. I just want to thank all of the other all the other panelists earlier, but I also want to thank the participants for staying on for this long. Again, it's been a long day, and hopefully we'll see everyone tomorrow. But again, I just want to say thank you, Dr. Pinn.
Thank you. Thanks to everyone for listening.